together, kind of like for the end. DIC, I'll tell you what I'm going to do. I'm going to do DIC and burns together because it's the exact pathophys. But let me cover these quickies first. Polycythemia, what do I have written by it? We already did it, splenomegaly. Psoriasis, what did you need to know? Well, it's a skin condition. Technically, your skin's supposed to regenerate every 28 days. It is autoimmune, and this patient's skin regenerates every 5 days. So they have flaky, reddish patches, and they can have silvery patches when they're not in what do you call it? An exacerbation. When they're not having an exacerbation, it's silvery. When they're having an exacerbation, it's pink or reddish. It doesn't necessarily itch. It doesn't feel like anything. It's not infectious. They need phototherapy. So phototherapy can work for them. Or anthrolin. And when it comes to the anthrolin, you had to remember to wipe it off. That's what it was. Wipe it off. How soon should you wipe it off? Is that clean? How soon? You guys remember from your test? No. 10 minutes to half an hour. Don't leave it on long. Wipe it off. No matter if it was, let's say I wrote it down. Did I write it down? Yes. Psoriatine is also used for psoriasis. It sounds like psoriasis, but it doesn't begin with a P. Psoriatine and vitamin A. Psoriatine and vitamin A, they're teratogens. Patient needs 2 methods of birth control. Psoriatine and vitamin A. Patient needs 2 methods of birth control for that one. Let's see here, what else? Anthrolin, we said was for psoriasis. Oh, yes, because psoriatine and vitamin A have very bad birth defects. Scleroderma, we talked about this. Let's do our CREST. Scleroderma is kind of easy. Number 1, the CREST is calcium deposits. So they make everything hard. Calcium deposits make everything really hard, calcified hard. The patient has a mask-like face with a very contorted, wrinkled mouth that's usually going to close. It's like a purse string. It's really taut mouth. They look really bad. R is Raynaud's. We talked about that already. E is, I would say, for you to put esophagus and then in parentheses put GERD. This patient for CREST gets teaching the same as the GERD patient. Exact same teaching. The S is sclerodactyly, and this could cause, sclerodactyly means that the patient can have auto amputation. The tips of the fingers can just fall off. Auto amputation. The tips of the fingers can fall off. Just fall off because there's scar tissue banding. T is telangiectasia. You'll see it in your notes. But just suffice it to say those are spider veins. Okay, that's done. Lupus I already did. Skin cancer I'm going to do now. Skin cancer, you have a handout in that same packet we were already in, I think, but I could be wrong because it's not a cancer handout. I don't know if I have it in here. No, I don't give a shit. I didn't put it in here. But let me tell you how easy it is. Look what I wrote. A, B, C, D, E. A, asymmetry. Oh, by the way, this is melanoma. All skin cancer is not created equal. Skin cancer, not created equal. Melanoma is the worst one. Just put melanoma. Skin cancer, melanoma equals A, B, C, D, E. A, asymmetry. B, irregular border. So A, asymmetry, B, irregular border. C, color variation, meaning it could be blue and gray or brown and black in the same mole. D is diameter. Let me tell you what the diameter is. It's 6 millimeters. Diameter is 6 millimeters. E is it's evolving. That's basically, you had to know all of these. Each one of these. It's not bad. I swear to God, it's not bad.
Evolving?
Evolving means changing. I don't know why you thought that. They don't have to be raised. No. No, my patient's dead, so no. Okay, so A, B, C, D, E. Asymmetry, borders irregular, color variation, diameter 6 millimeters, which is the top of an eraser tip. I take my eraser top, I take my pencil, and I go like this when I do physical exams on patients. Nope, gotta get a biopsy, 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 okay, biopsy. That's all I do. And I tell them they have to get a biopsy. E is evolving, it's changing. It's not staying the same. Okay, done. Melanoma is the one that's deadly. Everybody knows that, right? Melanoma is the one that's deadly. Squamous, not that deadly. Basal, B for basal, B for best one to get. You had to know sunscreen can be worn after 6 months, not before. You also had to know sunscreen is put on 20 minutes before going outside. You had to know 30 cc's was how much you use. So I'll say those 3 again. Sunscreen can be used on babies after 6 months, 20 minutes before you go outside, 30 cc's, which is a shot glass, should cover your body appropriately. Red hair, freckles, and blonde hair is at risk. Red hair, freckles, blue eyes, green eyes, blonde hair, all of those people are at risk. If you're on steroids, you're at risk. If you're a lupus patient, you're at risk for skin cancer. Smokers are at risk. Family history is at risk. Okay. First of all, Parkland formula, everyone. Parkland formula is going to be to take whatever the doctor has ordered, and you will not have to figure out the actual 24-hour fluid intake. Because if you did, if you'll remember, it was 4 cc's. Does anybody remember this? Per kilogram, per burn surface area. Remember that crap? Okay, you ain't gonna have to do that. You're not gonna have to do that part. If you do, okay, you do, fuck it. But I'm saying, usually you don't. It's not enough time on the test. So you don't have to do this, but what you have to do, the doctor gave you the order already. Let's do it together. The order was for 24 hours, 6,000 cc's. Notice what's really a big deal about that number. You and I, if we're going to have a fluid if we're going to drink fluids in any given day, we're going to drink about 2,000. This is 3 times that amount. This is called fluid resuscitation. If you don't do it, a 2nd-degree burn turns into a 3rd degree, or a partial thickness turns into a full. So that's why you got to do this shit. All right, now the patient comes in. You have to work your numbers off the time of the burn, not admission time. That's critical. Admission time is nothing. It's the time of the burn, which is not the same thing, because some people get flown in from another hospital. Okay, now he wrote 6,000. You give 1/2 over what? 8 hours. So how would I get that number? I would take this, and half of it is 3,000. Agreed, and divided by what? 8 hours. Right. How is it depending? It's 3,000 and 8 hours.
Right,
From the burn time. Period. We're not debating this. It's too late for this shit. Okay, so we're going to do it like that. This child's pregnant, she's tired. Now, so a half of it in 8 hours, she brings up a good point, from the burn time. Okay. The other half is in 16 hours. So instead of dividing it with 8, you use 16. Do we all agree on this? Now be careful. Because they may say, what do you give? What's the drip rate? So you still have to know per hour for both of these. per hour, what would have gone in? So let's do one. What would this be? Calculators out?
75.
What'd you say, Pumpkin?
375.
Okay, so a half of it in 8 hours, baby girl said 375. And how did you get that again?
3,000 divided by 8.
Okay, so 3,000 divided by 8. 3 is 24, you pull a 6 down. You know what you're feeling me on this? Okay, now here we go. This is the per hour rate. You gotta count the hours that they're asking you about. They may say something like, the patient was burned at 8 o'clock. Use that in your example. Patient was burned at 8 o'clock a.m. Use it in your example. Write it down. 8 o'clock, the patient was burned. They did not get admitted till 10 o'clock. They didn't get admitted till 10 o'clock. And they may say, by 4 o'clock, we know that 3,000 would have infused because that's 8 hours later, right? So that's easy. But what if they say by 1 o'clock, how much has infused? Can you do 8 hours for this? No, you have to do how many hours? 6, because they came at 10 o'clock. You gotta play catch up. You gotta play catch up. So go by the burn time and say to yourself, by 4 o'clock they should have had 3,000. But they didn't come till 10, so I lost 2 hours. So now I gotta do it by 6 hours. Okay.
Essentially, you take the 3,000 divided by
6.
versus the 8.
Yep, and then, depending on what time they asked you, how much has infused by, you add each one for those hours. Okay. All right, so that's fine. Don't forget the second half is given in 16. Okay, done with that. Parkland formula. Burn surface area. Now listen, the problem with y'all when y'all get to this point is you're tired. So you cannot, it's already on Facebook for days, weeks, months, or whatever. But you can't laugh. You can't. I know you're silly, but you can't laugh. Well, you could, but it's okay. You can't laugh at me. You have to count. How many 9s would I need to get really close to 100% burn surface area? How many 9s? Y'all can't add. That's only 81. What's 9 times 9?
11.
Thank you, boo. Pregnant brains, the little brain got this shit. So you ain't sleep yet. Okay, so 11 times 9 is 99. Are we agreeing? 99% is as close to 100 as you're going to get. What is your job? Start counting. This is called the burn dance. What happens here stays here. That's why your little asses can't record shit. Here we go. 9, 9, 9, 9, 9, 9, 9, 9, 9, 9, 9. Woo! 1. If you forget this shit, I will kill you. Because I just showed out big time, so your ass ought to remember to the day you die. It's a horrible, horrible scene. How many did you get? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, hold head, 1. This is my 99, I show 1. But you have to remember that. So you got all your 9s. That's all you have to know. Because you're talking about how do you know how badly they're burned? One whole arm is 9. Another whole arm is 9. If I take my torso or trunk, I could split it this way like I did when I did my little dance. 9, 9. Or I could split it this way. 9, 9. Same thing in the back of my trunk. The back, I did like this. Think 2 kidneys. One whole front side of my leg, 9, 9. The back leg, 9, 9. The whole head is 9. If you look at the mummy, it can be a little confusing, but that's why I did the little dance for you, so you won't be confused. What's more important than the mummy is the actual teaching on the side, because this is thebomb.com. if you look at it, you have breathing, urine output, resuscitation of fluid, nutrition, and shock. What I want you to notice is the resuscitation of fluid, which we did already. What I want you to put where it says electrolyte, I want you to put this patient has a high K. High K, low sodium. High K, low sodium, the first 24 hours. So you see it says salt and electrolyte solutions are essential over the first 24 hours. Again, high K, low sodium. Everybody see that under R? You'll get it soon. Oh, you know what? What's that baby's name? Did you find it? It's the stuff that I gave for them. It's not in y'all stuff.
I know, I'm back here looking for it.
Oh, no. Where did she put it? Oh, well, whatever. Anyway, listen. Just write down what I said. Okay? You're going to get one of these that I got or whatever. Okay. Maintain the blood pressure at 90 to 100. Number one, systolic has to stay over 90. Diastolic has to stay over 50. Why are we talking about blood pressure? Because volume controls blood pressure. 1/2 of the fluid for the first 24 hours should be administered over the first 8 hours. Then the remainder is administered over the next 16, yes? First 24-hour calculation starts at the time of the injury. We said that, okay. Now, rule of 9. This is what we use for adults only. We do not use rule of 9 for kids. We use it for adults only. Okay, then if you go up to urine output should be at least, not at least 30, I don't even want you to look at that number. It should be at least 50 to 70. Write down 50 to 70. And what measures volume when we talk about hemodynamic monitoring? Hemodynamic monitoring. What measures volume? Go back to cardiac. Okay, so CVP, V for volume. Look where the CVP is. Listen to me. The CVP is supposed to be, I always say 6 to 8. I know you learned some garbage, but I say 6 to 8. 6 to 10. 10 is fine for you and me. Look where the CVP is for this guy. What is it? It's on here. Under urine output. 12. Does everyone see that? Because only one person way down the way answered. And it's a concept you kind of got to see. It's under urine output. Look at the page. Tell me, do you see it, first of all?
Oh, yeah.
Okay, no, it's normal for this guy, is what I'm trying to point out. That's why you got to get your highlighter and really highlight it. This CVP is normal for this guy. Why? Because you gave him 6,000 freaking cc's. What does a CVP measure? Volume of fluid. You want this one higher. We gave this guy more fluid than the normal person, 3 times more. Do you see it yet? Maria, do you see it? Urine output, left side, top. CVP, 12. Okay. No, 6 to 10. Normal? Yeah, well, that's fucked up, because think about it. You ain't got no volume if it's 0. Isn't that stupid? That's the stupidest shit I ever heard in my life. Okay, so you know how this should be crazy, man. But you sweethearts, listen to me. Patients' CVPs, for you and me, normal people, 6 to 8, 6 to 10, anywhere in there. If it's too low, and the key is, did it drop? Yes, that's right, fluid volume deficit. If it's too high, fluid volume excess, except there's one person in the whole world that's allowed to be high, it's this guy. Because we gave them 6,000 cc's of fluid. Okay, now keep it moving. B for breathing. Oh, this is important. Highlight it. Facial burns, singed nasal hair, hoarseness, sooty sputum, bloody sputum, and I need you to add one more word, hemoptysis, because everything else is there. Hemoptysis. This means intubate immediately. You don't intubate, doctors do, but whoever the hell's around need to do it now. Because it means face, chest, or neck burns. Face, chest, or neck burns. That's what we're talking about with a patient that has singed nasal hairs and all sorts of kind of garbage. Okay? So endotracheal tube, immediately intubate. Stridor is on your exam. You hear stridor, we intubate immediately. Yep, stridor. Now, your types of burns. If you turn backwards, you should see something that gives you the types of burns. It'll say something stupid like, I don't know, first degree, I don't know. Oh, there it is, superficial, partial thickness, and full thickness. When we talk to normal people, we say first degree, second degree, and third. This is not a normal test. So we are talking superficial. In this circle, put this down. In the circle itself, put sunburn. Sunburn. No scarring. And highlight where it says no edema. It's epidermis only. Epidermis only. Highlight blanches. So the color will change. This is your curling iron burn, ladies. Okay, next one, partial thickness. For this one, I want you to highlight where it says painful and put most painful. Blisters, epidermis and dermis. Remember that a scald means steam, steamy water. Scalding means steamy water. This may convert to a full thickness without fluid resuscitation. This may convert to a full thickness without fluid resuscitation. The full thickness burn, you're going to make sure you know that this one is hard. It can be white, and even though it's painless, it can have pain in the surrounding tissues, which is what they said on the test. Pain in the surrounding tissues. Now, the emergent phase, which can go at the bottom, your emergent phase, write down emergent phase at the bottom of that page and just put fluid resuscitation. Emergent phase equals fluid, we're almost done with this. Emergent phase is fluid resuscitation. It is a high potassium, I'm saying it again because it's important, high potassium, low sodium. Your H&H is high because there's hemo concentration. Blood is thick, ain't no water. White blood count is high. White blood count is high because it's dirty, burns are dirty. Blood sugar is high because you're stressed. If there's no burns to the face, neck, or chest, and maybe it's just the legs, then your fluid resuscitation is your greatest priority. If there is an actual face, neck, chest, torso burn, oxygen, you can't intubate, you're not a doctor, but prepare for intubation, but give O2 until he gets the tube in. Okay, so oxygen with those patients. Anything, head, face, neck, chest, oxygen first, prepare for intubation, right? I mean, that's the priority. If you don't do it within the first 20 minutes to half hour, you're not going to be able to do it. You're not you, but the doc. Okay, so that's that. That was in your emergent phase, fluid resuscitation. Acute phase is wound care. The acute phase is all about wound care. So you have those damn drugs, and they all run together after a while. So we're going to give you what we got. Let's see. We're going to do silver nitrate first. Put down for this one, it's bacteria static. Bacteria static. You need to watch the electrolytes. It can decrease sodium and potassium. You need nitrile gloves. Nitrile gloves. Okay, that's that. Yeah, I buy them all the time. They're the colored ones. They're blue, they're purple, they're green, yeah. Because we don't do latex. So nitrile is pretty much what a lot of them are. Okay, now the next one is Silvadene. Silvadene is a sulfa type antibiotic. Sulfa antibiotic. It does not hurt, it's painless. You need to watch the white blood count. Watch the white blood count. Because it can cause leukopenia. It can cause leukopenia. This is bactericidal. So it'll kill bacteria. Bactericidal. Do not put it on unaffected skin. It treats bacteria and fungus, so yeast. Treats both. You have to put it on with a sterile tongue depressor using sterile gloves. And you do not necessarily have to cover it. So it's a topical sulfa antibiotic. Watch the white blood count. I'm going over everything I said. Because it can cause leukopenia. It's bactericidal. It can treat some yeast as well as bacteria. And it's painless. Okay. Sulfamylon is a topical antibiotic cream that is very painful. So you have to medicate 30 minutes before. For this one, you have to watch the arterial blood gases. You need frequent blood gases. This is the only one that penetrates eschar. That's why shit hurts. Medicate 30 minutes before. Santo, which is the last one, all you had to know for that one, this one debrides eschar. So this will debride the eschar. This will literally be used to debride eschar.
Or the Silvadene said put on with a sterile glove. Thank you.
And tongue depressor. Yeah, sterile glove, sterile tongue depressor. The last phase, this is all acute phase, that was wound care. The last phase is rehabilitation, and you just have to know if the patient can look at it, it's a good sign. If they can look in the mirror, it's a good sign. If they can put makeup on, it's a good sign. And if they can take it and do their own wound care, it's a great sign. But they do need to wear what's called a compression dressing for a year. That shit is hot and itchy. A compression garment for a year. If you wear the compression garment the way we tell you for a whole year, you won't have as much scarring, but you will hate us because it's itchy and hot. Okay, the patient will also be given a pass to go outside of the hospital and come back because it's very shocking, people's reaction to burn patients. And they have been under the loving, nurturing, compassionate care of good nurses. We accept everybody. When you go out here, people say stupid shit. Oh my God, you see his face? Oh my God. Little kids, mommy, stupid shit. So they get passes. Before they're discharged home, they get a pass.